So just diagnosis.
Yep.
Okay. So you got a 65-year-old man comes in, abdomen CT for unrelated. So there's gonna be like an incidental finding.
Okay.
Yeah, mass in the left kidney. Um, well-defined, round, homogeneous, enhancing mass. Large eosinophilic granules, round nuclei, abundant mitochondria. So what's the diagnosis? Okay. So clear cell, you're going to have large round cells. I don't know if they'd be eosinophilic, but they wouldn't have granules. I don't believe they're mostly clear and fatty. So I don't think it's angiomyolipoma, so I can cross that one out. So, I'm actually not sure about this one. The incidental, so it's incidental, so it's nothing, it's more chronic. It's not going to be causing any immediate issues.
So I guess my question for you is, what is the most specific finding in this vignette or this case?
Yeah,
Specific.
it'd be the biopsy. So the
Yeah.
large eosinophilic granule cells with round nuclei.
Yep. That's gonna be your most specific thing, right? And the
Mhm.
rest of it is a little bit more sensitive, right? So I guess the question is now, right? You're kind of obviously sometimes like when I'm reading this, and I to be honest, I don't know the answer to this question either. But the way I would look at it is, okay, I have the most specific thing, which is large eosinophilic granule cells with round nuclei. Okay, in my mind, right? This is what I'm saying. In my mind, right? How good am I in pathology? Not great, right? But in
Mhm.
my mind, that sounds to me that it's not cancerous in my mind, right? That's what I'm
Mhm.
thinking. And then it says the tumor cells have abundant mitochondria on electron microscopy, which in my mind, that is kind of worrisome because that means that it's very active, right? But I don't know, right? So now I'm confused, right? Like I'm just talking you through how I'm thinking through it, right?
Mhm.
Because you have a 65-year-old man, it's incidental, he's not having any symptoms, and it's 3 centimeters, it's well defined, it's round. Um, so in my mind, this points more for a benign thing, right? So if I were to put, a bet on the answer, right, I'd probably pick something benign. Is that actually correct? I don't know, right? But that's
Mhm.
how it worked through this, right? So, but yeah, what are you thinking? I want to hear what your thoughts are.
Yeah, I mean that makes sense. He's got no systemic things. There's no weight loss. There's no pain. There's no sensitivity. So that makes sense. Um, to be honest, I'm not terribly familiar with either renal oncocytomas or angiomyolipomas, but you can kind of break it down to where it's
Sure.
like, is it like a vessel and fat related
Exactly.
tumor? Is it kidney? Onco makes me think more malignant, but the cytoma, I'm not sure.
Sure.
Um, I know more about clear cell than the others, but this doesn't sound like clear cell.
Yeah. Yeah.
Uh, so, I mean, I probably just take a stab at it with either A or E based
Yeah.
on what we talked about.
So let's go through A here. The reason why A is actually benign. Okay, an
Mhm.
oncocytoma is actually a benign tumor. Um, it has some. I think the reason why it's named like that is that it might have some features that might look kind of weird, but it's
Mhm.
overall benign. But angiomyolipoma, the reason why I would know that's not right. How much do I know about renal biopsy path? Probably like not great, right? But like you said, breaking it down, angio meaning vessels. So they should be able to describe you something that looks like a vessel, right? Myo
Mhm.
meaning muscle, right? So they should say, some kind of smooth or striated muscle in the biopsy. And then lipoma is fat. So you got to have some of that in there, but there's none of that in there. So I'm like, unlikely. Clear
Yep.
cell, right? Usually they'll mention the reason why it's called a clear cell renal cell carcinoma, right? Is the fact that the cells, like they look like they're empty, right? Papillary meaning finger-like projections,
Mhm.
right? But remember, carcinoma, it has to be invading and things, right? I have no idea what chromophobe, renal cell carcinoma is. But the best answer, you see, kind of working through that, I'm like, this is likely benign, so I'll probably pick A. So if you're
Mhm.
trying to kind of, in a sense, right, taking this test, you're trying to kind of, put yourself in kind of that clinical setting, give yourself the best chance. But large eosinophilic granular cells, round, abundant micronuclei, and then this is going to be that renal oncocytoma. Clear cell, we kind of talked a bit, abundant cytoplasm, meaning it's like empty, right? Just a bunch
Mhm.
of cytoplasm, right? And then this is kind of papillary or tubular papillary architecture. It looks like finger-like projections, right? And then let's see, rare subtype of renal cell carcinoma, large pale cells with distinct membrane and perinuclear halo. So don't know anything about that. But yeah, so that's on a test taking standpoint. That's how you work through these, you know.
Mhm.
So just kind of, you know, I'm exactly in your situation. I'm sitting in the same exact position as you, right? But I'm trying to use every single piece of information to be like, okay, what answer can I choose to give me the best chance? Even though, you know, what do I know about renal oncocytoma, you know? So
Yeah.